The CEO of United Health Group, Stephen Helmsley.
Profits these insurance companies are making, folks, absolutely, they are obscene.
I'm from Watertown, Wisconsin. We've lived in the city of Watertown for about 6 years now. I have 3 daughters. My oldest daughter is Adriana, she's 10 years old. My middle daughter is Kennedy, and she's 8. And my youngest is Isabella, she turned 5 in April. Our world was pretty much turned upside down in a matter of minutes to us finding out that we would have a critically ill child who had not just one but multiple life-threatening disorders was just mind-boggling. At that point, ear infections were the worst thing in the world. We were told initially that the paperwork was lost. A couple weeks later, we were told by United Healthcare it was denied.
The big winners in this broken healthcare system. Let's look at who they are. The CEO of United Health Group, Stephen Helmsley. His salary, $3.2 million.
The incredible gross profits of the private health insurance industry that is at the core of the problem.
A few years ago, I think the president of United Healthcare made so much money that $1 in every $700 that was spent in this country on healthcare went to pay him. So,
did you hear that?
Pretty striking. It's pretty amazing.
They just got a little gasp out of those folks.
I know, yeah.
You're pulling it apart. We immediately appealed to see if we could get, you know, the coverage that we needed, and our first appeal was denied. Bella was continuing to suffer through very painful G-tube feedings to the point where she would actually try and rip her G-tube out of her stomach because they hurt her so much. She was to the point where she would literally look at a spoon and vomit. And we would have to, my husband or myself would have to hold her so that she wasn't swinging at us. And I also really felt that it was United Healthcare's responsibility to pay for it. We were told no so many times. It was incredibly frustrating. If they didn't pay this one-time cost, she was going to suffer.
Profits these insurance companies are making, folks, absolutely, they are obscene.
He was 6 months old. We were at the pediatrician, and he mentioned that Dylan would probably need the Doc brand helmet to correct the plagiocephaly. And if he didn't wear this helmet, then he could potentially have issues eating. 2 months into the treatment, we got the denial letter from United Healthcare saying that they weren't going to cover it. They viewed the helmet as cosmetic.
Why are we putting money into the profits of insurance companies rather than into medicine?
My name is Steve Helmsley, and I'm the president and the chief executive of United Health Group. Our mission at United Health Group is to help people live healthier lives. And our more than 80,000 employees do this every day for more than 70 million Americans.
My entire colon ended up getting large and pretty much dying, and with no explanation. They did several tests, and after my second surgery, and that's when they had to put me on the IV nutrition. Everything I ate just came straight through and was not being absorbed. That's why I had to have the TPN to keep me alive and to keep hydrated even. They kept telling my local pharmacy who was providing the TPN, oh, we're just waiting for one more letter, or we're just waiting for one more script, and then we'll start paying. This went on for 6 months, and December 4th, both the pharmacy and I received a letter through United Healthcare saying that they deemed it medically unnecessary and that they were not going to pay any of it. I tried to explain to them that if I do not have this, I will die, and the only response she gave me was okay.
Government officials are actually calling this the biggest health insurance scam they have ever seen. The victims are patients, in many cases, very sick patients.
To live in a society that would allow the CEO and higher executives of United Healthcare to make $750 million in stock, it's disgusting.
It was also very frustrating to know that they made that money off the backs of people like me.
Where is all that money going?
I can't imagine the kind of house he has or houses.
Behind all those numbers are real people.
I don't know how in the world you call yourself an insurance health care giver. It's just ridiculous.
Stephen Hemsley, how are you able to sleep at night?
About how to modernize our healthcare system.
Here's what's going on.
They're now being driven by Wall Street.
Cancel your coverage.
He says it's not in their best interest.
Now, the suit was brought by a number of institutional
shareholders. Has this ever happened to you? You go to a
allegations of unfair insurance reimbursement rates.
That's right, criminal charges.
See frequent evidence.
Woe to anyone who gets between them and the profits they reap from sick people.